Hi everyone, it's Dr. Karen with the Women's Midlife Specialist, and let's do some labs. Okay, this is my favorite thing to do, so let's start right here. First, I want to orient you. This is my hand moving in the center of the top of the page here, and I'm going to point to things with this hand so you can follow along. This is Cece. I took her date of birth and phone number out. She's 53 years old right here. She's had a hysterectomy with her ovaries removed, so she's not making her estrogen and progesterone herself. Now, she can make some testosterone because after menopause and even after our ovaries are removed, we make some testosterone in the adrenal glands. Okay, so let me first show you a few things that I notice about Cece. Number one, down here, therapies. She's not on any hormone replacement therapy at the time these labs were done. The second thing is her BMI is 24 and her waist circumference is 41 inches. So that is, if that's correct, then she has an apple-shaped body, and that is going to play a factor in my recommendations as we go along today. Okay, so let's take a look at a couple of things. Her estradiol is 0.5. With no therapy, the reference range is 0.5 to 1.7. Optimally, if no therapy is being used, it would be 1.3 to 1.7. Now, when she starts using replacement therapy, this goes all the way up to 12, and that's actually going to give you a lot more support and younger levels. Progesterone is 31, but when you look at the progesterone to estrogen ratio, it's low at 62. Now, without any ovaries, this is not nearly as low as many women after menopause and after their ovaries are removed. So this may have something to do with our waist circumference here. Now, I love this. She did estriol and estrone. Estriol is very low. We would expect that to be low because we only make estriol when we're pregnant. And we also make some from our estradiol and estrone because that converts to estriol. Now, estrone is the E1, the estrogen we don't want. She is within range of 1.0, and that is without any ovaries. So again, I'm questioning whether or not we may have some fat cells that are producing estrone. And then we look at testosterone and DHEA. She's pretty much in the middle of the testosterone, so she is making some without her ovaries in the adrenal glands, and her DHEA is also made in the adrenal glands, and she is 8.2. Cortisol is okay. Now I want to show you some graphs here. They provide us these graphs, which are wonderful. They show her estrogen lower than typical for a woman her age, or a lady her age. Progesterone, low but normal. Testosterone is a little higher than average. When you look at this graph, everything in the blue is considered normal range. This green line in the center is average for any particular age. If you look at her age, 53, she's sitting right above the green. And so that's good. We like that. Okay, we like that, except for the fact that it's not balanced with these guys here. Now, in a perfect world, we would love it actually sitting over here in the 30-year-old range, right? And the same with the progesterone and the same with the estrogen. We would want it sitting a little higher optimized. And here's her DHEA, and that is also high normal. And her morning saliva, we have just the morning saliva at the upper end of normal for a early morning cortisol level. Now, what does all of this mean? Okay. When you have low estrogen and progesterone, but your testosterone and DHEA are actually in the higher end of normal, one of two things could be happening. One, she has excessive stress because cortisol stimulates the adrenal glands, and the adrenal glands make testosterone and DHEA. So that could be happening. Or she could also, with this suspicion here of a waist circumference of 41, she may have an insulin glucose imbalance, meaning maybe pre-diabetic, may have some hyper or elevated insulin, elevated glucose levels after meals, and that's something that we don't want, and that is going to just pack on weight in the midsection and make it very difficult to lose weight, even when you try really, really hard and do everything right. If that's happening, it's almost impossible to see much improvement in the waistline. So what do we want to do? Well, it just so happens I've got some good suggestions here. But before we go to that, let's review this again. She's got mild to moderate estrogen dominance. So this progesterone to estrogen ratio is 62. That we want it to be optimal, a greater than 100. And so this is mild to moderate estrogen dominance. We don't want that. She's got a low E3, that's good. She's got a low number E1, and I like that too. Waist circumference is a little high for someone that's only 150 pounds, suspected apple shape. This is a higher risk of metabolic syndrome and possibly polycystic ovarian syndrome as a younger woman. She has a normal testosterone, a high normal DHEA for her age, and without having any treatment. And her cortisol is hanging in there, but guess what? We have something that we can go further and look at. Her symptoms actually support adrenal stressors and the need for support. Now I'm going to show you a very interesting part of the labs. One of the things that I love so much about ZRT is the questionnaire. The questionnaire tells me a ton of stuff. Okay, oops, I forgot to put my hand back on. Sorry about that. So the questionnaire tells me a ton of stuff. After you answer the questions, they put it together in this bar graph. And at the bottom of the bar graph, it shows you, check this out, it shows you where your primary problems lie based on your answers to the questions. Now, I want to tell you, I've been doing this for many, many years, almost 20 years, and I have found this section of the labs to be highly valuable. So I'm going to come back to this in a moment because I want to show you how we're going to help Cece with this particular issue. When you look at all of her symptoms, it comes out that this one here is the highest of problems. This is her biggest complaint, and it falls in the low cortisol category. Now, she only did a morning cortisol, and you may actually have good functioning adrenal glands putting out appropriate amounts of cortisol, but still have primary symptoms of low cortisol or high cortisol, telling you that you need to hop on that and focus on that because it's just not yet showing in a disease state. It's just moving in that direction. That's one of the reasons I love ZRT so much. Okay, so let's go back up here. So we've reviewed the labs. Now let's go to the next one. Put my little hand back up. So what do I recommend for Cece? This is what I recommend. And I'm going to say gold standard, meaning this is the primary thing that I would have Cece do if I were talking with her in my office face to face. Now, Hormone Heaven, 2 pumps twice a day, this beautiful thing here, will correct this estrogen dominance and get her at very nice levels. Now, the second thing is when I looked at her symptoms, one of the things she complained about or is disturbed about is hair loss. We all are worried about our hair if it starts falling out. It's not a good idea to have hair that's falling out because that hurts our self-esteem. And, you know, we really pride ourselves in our hair. And this is why I'm coming out with something called Sassy Locks. It's going to be 3 capsules daily. It's coming May 1st. But I've partnered with Age Vital with their Metabolic Hair Pro. You can actually get this product. It's their product. It's Dr. Jenny's product. And she's allowing me to put my name on it because I believe in it. It's actually a wonderful product and very important. Now, what can cause hair loss? Well, many things, cortisol issues, adrenal issues, but also thyroid issues. And when I look at all of her symptoms as a whole, I'm highly suspicious that Cece has low thyroid function. Her numbers when she goes and gets her labs, these are the labs that I recommend Cece get because, and want to make sure this free T3 and this reverse T3 and this thyroid peroxidase enzyme, antibody is within normal ranges, good ranges, because her symptoms also point to low thyroid function. And that is an animal in and of itself and needs to be corrected. Now, before I go further, and I want to show you where I get that from, because I really want you to understand how to read your own labs all the time. I go back to this area here and I look at what her symptoms are. And when she marked the answers to her symptoms, this was the severe ones that she felt were the worst for her. And here, hypometabolism is still in the red, way up here. Ladies, we need to have our bar graphs down here. We want to see them in the green. You'll have opportunity to see that in the green and maybe one in the yellow if we have to. But all of her symptoms are in the red, the highest being low cortisol, and also hypometabolism is thyroid. It's in the red. They're all pretty significantly, she's got a lot to deal with. So here is the second highest, and that shows estrogen dominance. And of course, her labs did indicate an estrogen dominance. So my recommendation is to get this thyroid checked out. Now, you can get TSH, free T4, free T3, and TPO through ZRT blood spot, but you cannot get a reverse T3. But you can get all of these through any lab. These are not done through saliva. This is done through blood, venous blood, or blood spot if you go with CRT. Now, Adrenovive is here, right here, over here to the right, my little hand. Adrenovive is the perfect adrenal supplement for you if you have low or high cortisol. So this one being that you can go either way because it is a supplement with adaptogens that help the adrenal glands recover from either too high, too low, or bouncing high and low. This is a very safe supplement to use. All right, so that's treatment one. Let's move on because Cece, I have more for you because I want to make sure based on the abdominal or waist circumference that I cover this part for you because it's very important. I've put this product here on this page. It's called D-chiro-inositol. Now, D-chiro-inositol is specifically excellent for women who have had PCOS history, because that really doesn't go away. It does improve after menopause, but it doesn't really ever go away. It's an indication that the insulin and glucose are imbalanced, and when there's a lot of weight gain in the midsection, that is suspicious. Also, with PCOS, we generally see this imbalance of testosterone and DHEA to the estrogen and progesterone. However, I cannot say that that is you, Cece, because you had your ovaries removed. So I know these levels, estrogen and progesterone, are going to be low. So I can't say this is you. So what I want you to do though, is I want you to watch the video about D-chiro-inositol and myo-inositol at this website. I have nothing to do with this website, but this is a very good website to go and learn about PCOS, also to learn about the difference between D-chiro and myo-inositol and why it's so important in the condition PCOS. Women with PCOS actually do not convert their myo-inositol to D-chiro-inositol very well. And when that happens, the blood sugar goes up, the insulin level goes up, and testosterone levels go up. So this is what causes that imbalance. And it's almost impossible to lose weight. I don't know that this is you though, Cece, so I want you to go and assess this and think about it. Now, one of the things that can help you determine whether or not possibly you had PCOS as a younger woman is if you had some difficulty getting pregnant, if you had multiple miscarriages, or actually just simply did not get pregnant very easily, or if you had a lot of skipped periods as a younger woman. These are some indications of PCOS if you never had the diagnosis. At our age, 53, there was less understanding about PCOS back in our day of reproduction. So it's going to be, something that you need to learn about and think about. Now, the other thing, so if you do decide, well, maybe this is me, your dose would be 600 milligrams twice daily. And that dose is based mostly on weight, but at your weight 150, that would be, and here's your weight here, that would be one capsule twice daily of this, or 600 milligrams twice daily. My recommendation, after you use at least these two products, I'm not sure about this one, then you would repeat your ZRT with estrone. You don't need to repeat estriol. Save you a little bit of money there. You can repeat it if you want, but estrone in 3 to 6 months to assure good conversion good conversion of estradiol, E2, and to assure E1 does not rise significantly, because women with PCOS or even a low level of metabolic syndrome or high insulin, a little high blood glucose after meals can spike their estrone with estrogen replacement therapy. So we want to make sure that that's not happening to you. I don't always recommend repeating labs so quickly, 3 to 6 months, but honestly, Cece, you fall in that category. All right, so we have one more, and that is down here. We're back to, I'm really doing a good job on you here, Cece. Back to these symptoms. Now, these symptoms, what I want to show you is this again. Actually, I already did it, but I'm sorry. So I want you to note that most all of the hormonal symptoms are equally distributed in the categories here. When you get your labs back, you'll see these categories and you'll have a good idea by looking at this bar graph where most of your symptoms lie. And you're pretty equal with the low cortisol being the most significant. Low cortisol, please take care of yourself, do some grounding, get those feet in the grass, the sand, walk barefooted, get your feet grounded, do some meditation if that speaks to you, some yoga, care for yourself. It's your turn. Let's start getting you rejuvenated. Okay, so why I wanted to show you this and why I want you to get your thyroid hormones also tested is that you never treat thyroid before you treat low adrenal function. Because if you ask the body to speed up the metabolism by treating the thyroid before your adrenal glands are ready, you can actually get more fatigued, you can actually have more symptoms. So we want to always treat the adrenals and the sex hormones before the thyroid. Sometimes the thyroid issues can go away once you treat the adrenals and the sex hormones. So that's why I wanted to show you this last one. Okay, my darling CC, I hope this helped you, and I hope this helped a lot of other people. We have so many labs to do. I will never be able to do just one a day. We're going to have to start doubling up during the day because tons of people have gotten their labs done, and I'm going to do every one of you to this level of perfection. Okay, guys, have a wonderful day. I appreciate you. Give me a thumbs up on this video, will ya? And spread it around, share it. Leave me a comment, make me feel good. Let me know I'm doing the right thing. Okay, thank you so much, guys. Bye-bye.